I was very intellectually curious. I loved science, I loved biology, and then I came to appreciate the impact that you can have in people's lives as a doctor. I am a hematologist. I specialize in blood cancers and in particular plasma cell disorders. So this is multiple myeloma, amyloidosis. I also see Waldenstrom's macroglobulinemia, or lymphoplasmacytic lymphoma, as you may see it. Finally, I'm also a member of the bone marrow transplant and cellular therapy team. Usually in the first visit, there's a lot of information gathering that goes on. So we're trying to understand some essential features of their disease, the onset, the chronicity. Sometimes the exact diagnosis isn't clear. We need to help determine a prognosis. And we need to prepare them for any treatment or surveillance plans that we're going to institute. So there's a lot of ground covered in the first visit, but once we get the disease-focused conversation out of the way, we also want to understand who the patient is as a human being, and who their family is, and how we can help them navigate the process, whatever that happens to be for that particular patient. So some patients have very aggressive disease that behaves more like an aggressive leukemia or lymphoma, and others can go years without ever having or needing treatment. So there's a huge variety of presentations of disease biology, and there's also a lot we can do to help people. Survival has gotten much better for patients, and quality of life has gotten much better, and I wanted to be part of that ongoing innovation. I think that going through the peaks and valleys alongside the patient helps us establish a really firm bond and understand what their priorities are and how they can live with their disease, as opposed to allowing the disease to sort of predominate in their lives. Seeing the patients do well, obviously, being part of clinical trials and part of new therapies that come to market, certainly very rewarding for me. And finally, it's the team that we get to work with here at the clinic. One thing that people should know if they have relatives that are Spanish-speaking is that I have a clinic at Lutheran Hospital where we focus on Spanish-speaking patients in particular. And in that clinic, I don't just see plasma cell disorders, we see all different types of blood disorders. I really want to make sure that the patients understand why we're doing what we're doing.